There are cases that I feel line up quite nicely for freehand, but there's more challenging cases that we need that information and that help with guided surgery. Regardless, I think it's essential to have CBCT imaging and be able to plan a case ahead of time. That takes away a lot of the guesswork and it removes a lot of the surprises that we have intraoperatively. I
place both guided and freehand implants on a regular basis. If I have a tooth site that's, I can figure the space, there's no reason to increase the cost of the guide for that patient. I use a guide in cases where I am concerned about, is the volume of bone going to be too restrictive to allow me to get that implant in the center of that space? If I'm doing a large case and I'm going to put in 5 or 6 implants, then yes, I want a guide because I want them to, as much as possible, be lined up parallel to each other so that the prosthetic aspect is as simple as possible. And that depends upon whether or not we're talking about a bar case or we're going to try to do a fixed bridge case. When we're talking about a large fixed case, I want the process to be simple later so that prosthetically they don't have problems in completing the case.
Using Simplant allows us to be able to determine where we want that implant position to be, to determine the existing bone volume, the amount of augmentation that is required or that we would like to obtain at the time or before implant placement, and allows me to discuss with my restorative colleagues the overall design of the prosthetics.